Healthcare financing. All of us are thinking about finances, and when you think about finances, all that comes to mind is money. And that money is, in this case, here around how do we receive healthcare services? Who pays for the healthcare services? And beyond paying just for the service, let's say, for example, when you're unwell, you go to a hospital, the consultation fee, the test, laboratory tests, the medicines that you buy, and all that. That is not only cost that we're looking at in terms of financing. There's the transport that you use to go to the hospital. There's the healthcare worker who is serving you, who is paying them to do that work. Who is building the institutions and the infrastructure that is needed? Who is buying the equipment? All that is around healthcare financing. So when we talk about healthcare financing, the question we need to be asking ourselves, how do we ensure there's reliable financing of our healthcare systems? Their budget declaration mandated governments to be able to use up to 15% of their budgets in healthcare service delivery. That has not been attained over time, and we all acknowledge that. So the next thing is, how do we push for better financing from a government standpoint, but also how do we come up with innovative financing models that will ensure that we're able to achieve universal healthcare coverage by knowing that we have the right facilities and equipment, we have well-paid healthcare workers who are able to deliver the services, the medicines and healthcare products that we need are available. And for young people, there are some of us who are running health-related initiatives in our communities. How do we finance our interventions? How do we make the money doing it? And beyond that, at an individual, as a young person, you might be unwell. When you go to a hospital, who pays for your healthcare needs? Do you depend on your parents? Yes, that would be the case. But for those of us, maybe you have health insurance. Does your health insurance cover for you? And what are the incentives that you'd have? And are young people, most of us, taking the healthcare covers for start? I know most of us are not having insurance covers. It's including the National Health Hospital Insurance Fund, NHIF. And these are some of the discussion that we need to be having. And the key bit for me from this kind of discussion would be, how do we incentivize young people to take insurance? Because you never know when you have a need for that insurance cover. And therefore, you need to see what are the dynamics. And you, as a young person working in the local communities, how do you engage people to take up insurance cover? Because at the end of the day, when they need the services, they'll be able to afford them because there is a cover. We've all been in WhatsApp groups where we are contributing. We've all been in these donations and drives and all that. It's what we do now, but is it sustainable? And if it's not sustainable, what new financing mechanisms can we think of for your interventions, for calling the government to account, stimulating private sector investment to ensure that we have a working healthcare system that is well financed? These are questions that we need to be asking. And as we're asking them, we need to come up with solutions. It's not about asking questions and pulling people left, right, and center. It's about asking questions, thinking through the questions, and actually asking ourselves, what can we do to ensure that the financing systems are able to work and able to deliver? And on that, I'm urging you to join us 1st to 3rd of December, Amref International University, for the 2nd annual Youth Voices Summit. Let's make the future better by investing in our solution, investing in our ideas, and calling ourselves to action by committing to do it. Thank you.